The following segment is sponsored by Humana.
America is getting older. In fact, more than 4 million people in the U.S. will celebrate their 65th birthday this year alone. Here to explain and share the key steps for these younger seniors to explore is Dr. Jennifer Taylor. Welcome to the show, Doc.
Thank you. Thank you for having me.
We are so glad to have you. Now, what advice would you give people turning 65 this year to start preparing for being eligible for Medicare?
Well, there's a few things. The first of which is to start doing your research early. It's important to understand all the different parts of Medicare so you can make an informed decision that's based on your own needs. Original Medicare covers hospital stays and doctor's visits, but there's a deductible for each and there's a 20% cost. Whereas Medicare Advantage is offered through private insurers like Humana, and it covers hospital stays, doctor's visits, ER visits, and it may even cover prescription drugs at no extra out-of-pocket cost. Plus, there's a yearly cap on how much you have to pay out of pocket, excuse me.
I feel like we all need to start our research now. 65 is coming closer and closer. Now, for those seniors who don't have a primary care provider, what considerations would you recommend when making that choice?
Having a primary care doc that knows you, your individual needs, and your individual risk factors can make a huge difference in your quality of life and longevity. So we recommend that you choose someone that's involved in a value-based care arrangement. And the reason why we recommend that is that with value-based care, you get more frequent visits, longer visits. So you get more of an opportunity to ask your questions. Your doctor gets to know you better. Your doctor gets to know things about you socially and emotionally that might impact your health. And you can get information about value-based providers from your insurance company.
Great. Now, how can these younger seniors stay healthy? Because that's the best kind of care, is not to get sick at all, right?
Exactly. So once you've chosen your primary care doctor, the next step is to schedule an annual wellness visit. That's where you'll sit down with your doctor. You'll go over all of the different preventative screenings that are available to you, and you'll choose the ones that are best for you based on your own individual risk factors. Screenings can make a huge difference in your outcomes. And then the other thing I recommend is that you understand your Medicare benefits. For example, Part B covers things that you may not even realize, like smoking cessation, and Medicare Advantage can offer a host of other benefits.
Well, and there is so much to learn. Where can we go and learn more?
The best place to go is Medicare.gov. You can compare plans, see star ratings, which tell you about the patient experience and the quality of care. And then for more information about Humana's offerings, you can go to Humana.com.
Great. Thank you so much, Dr. Taylor, and have a wonderful day.
Thank you for having me. You too.